Health authorities across Northern Europe are issuing urgent advisories this May as a significant surge in Puumala hantavirus cases threatens to overwhelm regional clinics, particularly in the northern reaches of Sweden, Finland, and Norway. This 2026 season has seen an unprecedented spike in Nephropathia epidemica, the clinical manifestation of the Puumala strain, which is traditionally viewed as a milder relative of the lethal hantaviruses found in the Americas. However, current surveillance data indicates a worrying trend of severe systemic involvement, prompting researchers to investigate why this particular surge appears to be more aggressive than those recorded in previous decades. Geographically, the concentration of cases is highest in the boreal forest regions, from Sweden's Västerbotten County to the Oulu and Lapland regions of Finland. Public health officials are tracing this uptick to a massed year in 2025, where an overabundance of tree seeds led to a population explosion of the bank vole, or Myodes glirolus. These small rodents serve as the primary natural reservoir for the Puumala virus, carrying the pathogen without falling ill themselves while shedding it through their saliva, urine, and feces. For viewers, the concern lies in the ease of transmission. Humans typically become infected not through bites, but by inhaling aerosolized particles of dried rodent excreta. This often occurs during routine activities like cleaning out summer cabins, stacking firewood, or working in dusty barns and sheds. As the spring thaw concludes and residents begin seasonal maintenance on rural properties, the risk of breathing in these invisible virus-laden clouds is at its peak. While hantaviruses generally do not spread between humans, a fact officials are emphasizing to prevent public panic. The sheer volume of environmental exposure this year is testing the limits of local healthcare infrastructure. The framing of this outbreak has shifted from a routine seasonal occurrence to a major public health priority, as clinical reports from the first 10 days of May 2026 suggest that the Puumala strain is manifesting with a broader range of symptoms than the classic fever and temporary kidney impairment typically associated with the virus. The core of the current crisis is being managed by a network of national agencies, including the Swedish Pathogens Portal and the Finnish Institute for Health and Welfare, known as THL. These organizations are closely monitoring laboratory results that suggest the 2026 Puumala strain may be causing more severe vascular leakage than previously documented. While the virus primarily targets the kidneys, leading to acute renal failure and severe back pain, medical centers in Umeå and Helsinki are reporting an increase in patients exhibiting symptoms of systemic inflammatory response syndrome. This includes pulmonary edema and liver enzyme elevation, lending weight to official concerns that the virus is effectively attacking every major organ system by compromising the integrity of the vascular endothelium. This development is being analyzed in tandem with the high-profile Andes virus outbreak currently affecting international travel, including cases linked to the MV Hondius cruise ship. While the Andes strain, which has a much higher fatality rate and limited human-to-human transmission, is a distinct entity, its emergence this month has placed European laboratories on high alert. Scientists are currently performing genetic sequencing on the Puumala samples collected in Northern Europe to determine if a specific mutation is responsible for the heightened severity, or if the multi-organ impact is simply a result of higher viral loads being inhaled by patients in high-vol density areas. Lab workers are also contrasting official claims from late 2025, which predicted a moderate season, against the current verified data, showing hospital admission rates nearly double the 5-year average. In some regional hospitals, specialized dialysis units are operating at full capacity to treat patients with hemorrhagic manifestations. There is no specific antiviral treatment for hantavirus. Therefore, the clinical focus remains on early supportive care, fluid management, and mechanical ventilation in the rare cases where respiratory distress occurs. Public health agencies are stressing that while the public health risk to the general population remains relatively low, the risk for individuals in rural or forested environments is significant and requires immediate attention to diagnostic markers like blurred vision, sudden high fever, and severe abdominal discomfort. Prevention and proactive surveillance are the primary tools currently being deployed to mitigate the spread of the Puumala surge. The official guidance from health ministries is clear. Residents in affected regions must avoid dry sweeping in areas where rodents may have nested. Instead, the use of a 10% bleach solution or other wet disinfectants is recommended to dampen dust and neutralize the virus before cleaning begins. High-grade respiratory protection, such as N95 or FFP3 masks, is now being advised for any high-risk tasks involving the handling of firewood or the clearing of long-standing structures. Despite these clear instructions, officials admit there are honest limits to our current knowledge, particularly regarding how long the virus remains viable in the environment during the erratic weather patterns seen in early 2026. Surveillance of the bank vole population continues, with ecologists noting that the lack of consistent snow cover over the past winter may have allowed more rodents to survive and breed, further complicating the public health outlook for the remainder of the year. There is no commercially available vaccine for the Puumala virus in Europe, making environmental control and public awareness the only viable defenses. As of May 10, the situation remains fluid, with experts hoping that the coming summer heat will naturally reduce the lifespan of the virus in outdoor settings. For now, the message from the medical community is one of calm but heightened vigilance. If you or someone you know develops a sudden unexplained fever after visiting rural areas in Northern Europe, seeking medical evaluation is essential, as early intervention for kidney and pulmonary complications is the key to a full recovery. We will continue to monitor official statements from the ECDC and national health boards as more data from the 2026 surge becomes available. For more updates on global public health developments and breaking news, consider subscribing to this channel. The core of the current public health response is centered on a coordinated data-sharing network between the Swedish Pathogens Portal and the Finnish Institute for Health and Welfare, known as THL. As of mid-May 2026, laboratory results from these agencies indicate a significant deviation from historical norms regarding the Puumala strain's clinical profile. Traditionally associated with nephropathia epidemica, generally self-limiting form of hemorrhagic fever with renal syndrome, the current surge is manifesting with a broader systemic impact that officials are describing as multi-organ involvement. In regional medical centers such as Umeå University Hospital and Helsinki University Hospital, clinical teams are documenting an increased incidence of vascular leakage syndrome. This occurs when the virus targets the endothelial cells that line the human vascular system, compromising their structural integrity and allowing fluid to escape into the interstitial spaces of major organs. This mechanism explains the rise in pulmonary edema cases, where fluid accumulates in the lungs, and the elevated liver enzymes being recorded in patients who, in previous outbreaks, would have primarily presented with kidney dysfunction. The logistical strain on Northern European healthcare systems is becoming a primary concern for regional administrators. In Sweden's Västerbotten County and Finland's Oulu and Lapland regions, specialized renal units are reporting that dialysis capacity is reaching its upper limits. While the virus itself does not have a specific approved antiviral treatment, the standard of care requires intensive fluid management and, in severe cases, mechanical ventilation or renal replacement therapy. The surge has forced a reallocation of medical resources from urban centers to rural district clinics that are closer to the boreal forest infection hotspots. Simultaneously, reference laboratories are engaged in high-throughput genetic sequencing to determine if the 2026 Puumala strain has undergone specific mutations or if the severity is a byproduct of exceptionally high viral loads. This theory suggests that the population explosion of the bank vole reservoir has created environments where the concentration of aerosolized viral particles is significantly higher than in previous decades, leading to a more intense initial infection in humans. This regional crisis is being monitored within a broader global context of hantavirus surveillance. International health agencies are contrasting the Puumala data with parallel reports involving the Andes virus, a more lethal relative known for its potential for limited human-to-human transmission. Specifically, surveillance teams have been tracking the movement of pathogens in high-traffic maritime and travel sectors, including recent reports of viral activity linked to the MV Hondius cruise ship. While these two strains occupy different ecological niches and possess different mortality rates, the simultaneous spike in both northern and southern hemisphere hantaviruses has placed global virology labs on a high alert status. In Europe, the focus remains on the verified versus claimed data regarding the 2025 mast year. While ecological models predicted a rise in rodent numbers, the actual clinical impact seen in May 2026 has surpassed early government estimates, leading to a scramble for diagnostic kits. Diagnostic laboratories are currently prioritizing patients showing the triad of symptoms: sudden high fever, blurred vision, caused by transient lens swelling, and acute abdominal or back pain. The honest reality admitted by health officials is that the diagnostic window is narrow, and the surge in cases is testing the turnaround time for PCR and serological testing. Despite the increase in severity, officials maintain that there is no evidence of the Puumala strain evolving toward human-to-human transmission, keeping the focus of the current logistics and surveillance efforts strictly on environmental exposure and rodent-to-human pathways. As the boreal spring progresses into the peak of the 2026 maintenance season, the primary strategy for mitigating the Puumala surge remains anchored in aggressive public education and localized environmental management. Public health agencies across the Nordic region are reiterating that the most critical preventative measure is the immediate cessation of any activity that creates airborne dust in potentially infested environments. The official guidance issued by the European Center for Disease Prevention and Control, or ECDC, in conjunction with national boards, emphasizes a wet cleaning protocol. This entails using a 10% bleach solution or a strong household disinfectant to thoroughly saturate any area where rodent activity is suspected, such as summer cabins, woodsheds, and attics, before any cleaning begins. Because the hantavirus is an enveloped virus, its outer lipid layer is highly susceptible to chemical disruption. However, it remains dangerously stable in cool, dark, and dry conditions. Experts warn that using vacuum cleaners or dry brooms is strictly prohibited in these settings, as these methods effectively act as force multipliers for the virus, thrusting concentrated, aerosolized particles directly into the breathing zone of the individual. For those engaged in high-risk occupations like forestry, construction, or seasonal property clearing, the use of FFP3 or N95 respirators is no longer a suggestion but a formal safety recommendation. The surveillance component of this public health response extends beyond the clinic and into the forest. Ecologists and virologists are currently monitoring the vole cycle with precision, noting that the intensity of the 2026 outbreak is a direct consequence of the 2025 mast year, where an explosion of forest seeds provided the caloric foundation for a massive rodent population boom. Current surveillance data suggests that while the bank vole population may begin to stabilize as predator species like owls and foxes catch up to the prey density, the environmental load of the virus will remain high through the summer. This creates a sustained risk for travelers and hikers moving through the northern corridors of Sweden and Finland. Public health officials are urging a balanced approach to this information, discouraging the indiscriminate killing of rodents, which can inadvertently drive infected survivors into closer proximity with human dwellings. Instead, the focus is on rodent-proofing structures, sealing gaps larger than a pencil width, and removing outdoor food sources that attract the Myodes glirolus reservoir. There remain significant and honest limits to the current scientific understanding of the 2026 surge. While researchers are investigating the possibility of increased virulence, they must also account for the concentration effect, where the sheer volume of environmental contamination leads to higher initial viral exposure, potentially overwhelming the human immune system more rapidly than in low-density years. The absence of a commercially available vaccine for Puumala hantavirus in Europe remains a gap in the long-term defense strategies, leaving supportive care as the only medical recourse. Ethically, health authorities are balancing the need for transparency with the necessity of preventing regional panic. They emphasize that, while the systemic multi-organ involvement reported this year is serious, the vast majority of cases still result in recovery if medical attention is sought at the first sign of acute fever or visual disturbance. The reporting of this surge serves as a critical reminder of the intersection between climate, ecology, and human health. As we monitor the laboratory sequencing results and hospital admission trends through the end of May, the mandate for the public remains one of extreme caution in rural settings and immediate compliance with sanitation protocols. For continued coverage of global health security,